Sierra Shopwalker. I'm a senior athletic training student at Florida Gulf Coast University. Today, I'll be demonstrating how to conduct a SCAT-5 concussion assessment. So, step one, our most important, looking for our big red flags, So we have our neck pain or tenderness, double vision, weakness or tingling, burning in arms or legs, severe increasing headaches, seizure convulsions, loss of consciousness, deteriorating conscious state, vomiting, or increasingly restless, agitated, or combative. I think you're good. Awesome. Moving on to step two. So we have our observable signs. And, again, especially now I'm an athletic trainer, so I witnessed these. I didn't observe on video, but that's also another option. So, yes or no questions. So, was our athlete laying motionless on the playing surface? No, that's good. Balance gait difficulties, motor and coordination, stumbling or slow labored movements? No. Disorientation or confusion, or an inability to respond appropriately to questions? No, you're good. Blank or vacant look? No, you're good. Facial injury after head trauma? Good. Moving on. So we have our step 3 memory assessment. So these are our Maddox questions. So, first I'm going to ask you, what exactly happened. You'll let me know. And then we're going to go into yes or no some questions. So, if you get it correct, you get a yes. If you get it incorrect, you get a no. So, what venue are we at today?
Harry's living room.
Yes. What half is it right now?
Second half.
Yes.
Fourth quarter.
Very specific. Love it. Who scored last in the match?
I did.
What team did you play last week?
Brianna's team.
Good job. And did your team win the last game?
Yes.
Awesome. Very good. Okay. So we have our step 4 examination, or our Glasgow Coma Scale. So, we have our E portion of it, which is our, is there no eye opening? Do we have eye opening in response to pain, eye opening to speech, or eyes opening spontaneously? And I would rate those on a scale of 1 to 4. And then we will go to our V portion, which is best verbal response. So either no verbal response, incomprehensible sounds, inappropriate words, being confused, or oriented. And we would rate those. That is 1 to 5. And then we have our best motor response, which is our M portion. So no motor response, extension to pain, abnormal flexion to pain, flexion or withdrawal to pain, localized pain, and obeys command. So we rate that, and then our Glasgow Coma score, we're going to add up the scores from our E, V, and M to get our final result. So then we go into our cervical spine assessment. So does our athlete report that their neck is pain-free at rest? Good. Yes. So if there is no neck pain at rest, does the athlete have a full range of active, pain-free movement? So can I have you bend your head forward? Can I have you bend your head all the way back? Can you bring your ear to your shoulder? Bring your ear to your shoulder. Can you look that way? Can you look that way? Is there pain with that? Oh, perfect. Woo. Awesome. Is the limb strength and sensation normal? Can you push against me? Well, I check for extension, lateral flexion, and rotation as well. Can you feel this? Can you feel the rest of your face? Your head? Good. Okay, good. That's normal. Okay, so what sport or team do you play for?
I play volleyball at Meridian High School.
Awesome. Okay, what is the date today?
Today is June 1st.
Do you remember the time of injury?
I'm gonna say like 10:40-ish.
Okay, awesome. So, years of education completed?
3.
Awesome. How old are you?
21.
Are you male, female, or other?
I'm gonna go with female.
Okay. So, what is your dominant hand?
Right.
Right. Okay. How many diagnosed concussions have you had in the past?
6.
Okay. When was the most recent concussion?
2 months ago.
Okay. And how long was the recovery to be cleared for that concussion?
About a month.
Wow.
My AD something.
God, those ATs. So, have you ever been hospitalized for your head injuries? Yes or no? No. Diagnosed or treated treated for a headache disorder or migraines?
No.
No. Diagnosed with a learning disability or dyslexia?
No.
Diagnosed with ADD or ADHD?
Mm-mm.
Okay. Diagnosed with depression, anxiety, or other psychiatric disorders?
Not yet.
Awesome. Are you on any current medications?
No.
Okay, that's good. Awesome. So we will go through our symptom evaluation, So I would give you this form, but we're just gonna run through it really quick, and you would do this yourself, but I'm gonna do it for you because I'm nice like that. So we would rate all of these symptoms on a scale of 0, which is no pain. We would have mild pain, which is 1 to 2, moderate pain, which is 3 to 4, or severe, 5 to 6. So you're just gonna tell me as we go down. So headache,
0.
pressure in head,
0.
neck pain,
0.
nausea or vomiting,
0.
dizziness,
0.
blurred vision,
0.
balance problems,
0.
sensitivity to light,
0.
sensitivity to noise,
0.
feeling slowed down,
0.
feeling like you are in a fog.
0.
Okay. You don't feel right.
0.
Okay. Difficulty concentrating.
1.
Difficulty remembering.
1.
Okay. Fatigue or low energy.
0.
Confusion.
0.
Drowsiness.
0.
Feeling more emotional.
0.
Irritability.
0.
Sadness.
0.
Are you nervous or anxious?
0.
Okay. Do you have trouble falling asleep?
1.
Okay. So we would take the total number of all those symptoms, add them up out of 22, and that would be your score. And then our symptom severity score would be out of 132. So do your symptoms get worse with physical activity?
No.
That's good. And do your symptoms get worse with mental activity?
No.
So if they're 100%, so let's say, 100% is you're feeling perfectly normal. What percent do you feel right now?
Like 92-ish.
Okay, so why is it not 100?
I'm sleepy.
Just sleeping. Okay. Alright, so at this time you would hand the form back to me, if we had time to do that. So we're going to do our cognitive screening now. So our orientation. So I'm going to have you tell me a couple questions, This is going to be 5 questions. If you get it right, you get 1 point. If you don't get any points. So can you tell me what month it is?
June.
What is the date today?
The 1st.
What is the day of the week?
Thursday.
What year is it?
2015.
What time is it right now?
I'm gonna go not 12. And 43.
You're close. It's 10:57, but that was good. Okay, awesome. So you're going to go to our immediate memory. So this is the fun one because I'm going to give you a list of words and you're going to say them back to me, in order or just as you remember them. And you can ask 10 words at a time or 5, as you go down. But because I know you as an athlete, I know you're probably gonna want those 5 words at a time. So we're gonna go with that one. So we would do this 3 times, but for the sake of this, we are going to do it once. So I'm gonna list. I'm gonna pick list 8, and you're gonna repeat these words back to me. So we have jacket, arrow, pepper, cotton, movie.
Movie, cotton, pepper, jacket, arrow.
Perfect. Awesome. Good job. And we would go A through F with that. And then, we do have our 10-word list. So I'm gonna do this, and we're gonna see how much you remember. Okay, you don't have to say them in order, but this is gonna be out of 30. So this is 10 words. So we have jacket, arrow, pepper, cotton, movie, dollar, honey, mirror, saddle, anchor.
Jacket, pepper, cotton, mirror, dollar, honey. Yep, that's about.
Okay. Okay. Boop, boop, boop. We score that. Good job. Okay. So now we are going to focus on your concentration. So our digits backwards. Okay. So we are going to know you have lists A, B, and C. So I'm going to read these numbers, and when I'm done, you're going to repeat them back to me in reverse order of how I read them to you. So if I say 719, you say 917. Okay. So 493.
394.
Good. 629.
926.
3814.
4183.
Good. And I would continue going down that list as the amount of numbers gets bigger. Circle yes or no if you got them correct. Okay. So now we have our months in reverse order. So now tell me the months of the year in reverse order. So starting with the last month and go backwards. So I say December, November, and you continue with
October, September, August, July, June, May, April, March, February, January.
perfect. Awesome. So then we score that. Concentration total score would be our digits plus our month score, and that would be out of 5. Awesome. So now we have our step 4 neurological screening. So these are going to be yes or no questions. So can the patient read aloud and follow instructions without difficulty? Yes. Does the patient have full range passive cervical spine movement? We did active, so we know you have to have passive, so that's a yes. Without moving the head or neck, can the patient look side to side and up and down without double vision? So focusing on my finger, don't move your head, just your eyes. Up, down, side, side. Good. Check. And can the patient perform, oh, I skipped one. Can the patient perform the finger-nose coordination test normally? So, focus on my finger, and we go in. Good job. Okay, and we have our can the patient perform tandem gait normally? So, yes, you're awesome. You can perform it. So, we have our balance examination. So, you're going to, first of all, what is your dominant foot?
Alright.
Okay. Our testing surface is going to be really hard carpet. And we are going to have socks as our footwear. So, can I have you stand up, please? These are all the actions. So first, we have our double leg stance. Just stand 2 feet. Awesome. So then, we have our single leg stance on your non-dominant foot. So can you stand on your non-dominant foot? Good. Perfect. Can you stand with your non-dominant foot in front? Yes. Non-dominant foot. No. At the back. There you go. Balance. Make sure your toes are touching that heel. Good. Alright. Total errors, all that fun stuff. And then we have our step 5, our delayed recall. So the delayed recall should be performed after 5 minutes of elapsed time at the end of the immediate recall section. You're going to score 1 point for each correct response. So do you remember that list of words that I read a few minutes earlier? Tell me as many words from the list that you remember.
Honey, cotton, something about a jacket.
Mm-hmm.
Nope, it's not all I got.
Okay. Okay. So, you would record that. The total number of words you record accurately out of 5 or out of 10. Okay. So, let's go to our step 6. So, we have our final decision. So, we would calculate, our symptom number out of 22 and go through all of that. And we would score up our symptom severity score, our orientation, immediate memory, concentration, our neuro exam, balance and errors, and delayed recall. Add up all those. And then if the athlete is known to you prior to the injury, are they different from their usual self? So, this is where I go through and check. Concussion diagnosed. I think we're good. So, I'm going to say unsure, but I'm not certified athletic trainer, so this may not be applicable for this, but we'll see. And then, retesting, has the athlete improved? We haven't started that yet. But, so, I'm not a physician or licensed healthcare professional, but I'm going to make a prognosis that, and I personally administered or supervised this administration, and I would sign off. And